So Medicare is the Australian story. It was founded on the principle that it doesn't matter who you are, whether you're rich or poor, whether you're unlucky enough to have been born with a genetic disease, whether you've developed one later in life, whether you're run over by a bus, that you get access to top quality health care. It doesn't matter the size of your bank balance. It doesn't matter how many children you've got at home. It doesn't matter whether you've developed diabetes later in life. What matters is that we, as a rich, prosperous nation, will provide health care for everybody. For everybody. But what this government is trying to do is to tear it down. Is to tear down Medicare. It's never supported Medicare. It's been introduced under a lie. The lie that our health system is unsustainable. Well, let's look at that. Healthcare in this country is affordable. The cost as a proportion of GDP has been steady. And we spend half what the US spends on healthcare, and we've got a much better health system. But we are on a fast track to a two-tier, highly privatised health system where you get one level of healthcare if you're wealthy and have a high level of private health insurance, and you get second-rate healthcare if you're on a low or middle income.
Healthcare should be about caring for one another because we live in society together. That's what the system Medicare is built on. That's the premise, and that's the premise we need to keep in place moving forward. And let's be clear, while $5 or $6 seems like an insignificant amount, we will absolutely see this number go up. As we said before, this is very much a thin edge of the wedge issue. This will increase, have no doubt about that. This will be a push from the insurers. This co-payment will go through the roof, guaranteed. And this rally is just the start. It's going to be a long and protracted campaign. And so everyone here, it's really important that we get as educated as we can, and we encourage our family and friends and those around us to come out and have their say.
It's the only message politicians understand. Scare them. That's what we have to do. We have to do a lot more than just have a rally here on the steps of the state library. We have to get into the hearts and minds of a lot of people and make them worry the politicians in marginal elections. What the policy now is doing is showing, even though the government are saying we haven't decided yet, we just carefully arranged the release of all this information to find out what people thought. But we need to tell them what we think.
We don't want it.
We don't want what they're doing. We want Medicare as strong or stronger than it was before.
So that was only going back into 1972. That almost 20% of Australians had no private health cover. Have a think about that. What happened after that, of course, was we had the Whitlam government elected. And in 1973, Bill Hayden introduced legislation into Parliament that created what became Medicare, what was then Medibank. And since that time, as has been reiterated by speakers before me, every time we have a Liberal government, an attempt is made to dismantle Medicare. What they're doing this time is particularly tricky. What they're saying is, what's $6? $6 will somehow magically make me think I may or I may not go to the doctor. What a ludicrous proposition to think that I am more or less likely to go to the doctors for $6. But however, there are people who will not go to the doctor for $6. What it's really about is they know that it affects about 10 or 15% of the population. Most of whom wouldn't vote for them anyway. So they don't think there's great political damage to be done in introducing that $6 fee. But if it was $60, what difference would that make? How many people in the population would that affect? If you want to know the difference, just wait 10 years. Let them get away with the $6 and it'll become 10, 15, 20 and 50. And I wouldn't mind betting that they've done a deal with the private health insurers who will cover that for people who can afford private health insurance. Who did the study? Who paid for the study of the $6? It's well advertised that it was Australian Unity, one of our large health insurers. What might be in it for them? This $6 fee is just the end of the wedge, mate. No mistake about it. Whenever there's been a tax on Medicare, and this is one step of a very, very big attack on Medicare, the unions have been there. And the unions, I can assure you, will be fighting very, very strongly to ensure that we continue to have the best health system in Australia now.
The amount we spend on healthcare isn't spiralling out of control, it's steady. And what is the point of having a growing economy, of increasing our GDP, if we can't spend some of that money on healthcare? This is a wonderful situation to be in. Developing countries right around the world would kill to have this problem. What are we talking about? We're talking about being able to fund some of the most expensive, high-tech medical interventions that allow us to live longer and more prosperous lives. That is a good thing. Don't buy into the myth that our health system's unsustainable. We have a world-class health system, costs are under control, and what we need to do is to build up Medicare, not to tear it down. Why on earth are we handing over billions of dollars in subsidies to the private health insurance industry when we could be providing dental care under Medicare for every person in this country? We wouldn't need private health insurance if everybody in this country was able to see a dentist just as easily as they can go and see a doctor. We can do it. It's a matter of will. It's a matter of evidence, because the evidence says very clearly a single insurer, publicly funded, is not just fairer, but much more efficient in terms of delivering healthcare services. So this is a government driven by ideology, but it wants to spend more money and get a worse product. That is economic vandalism, and we shouldn't stand for it.
The thing that I want to talk about is the message of austerity that we keep being fed by Conservative and Labor governments who are Conservative, let's face it. They keep comparing world and national economics to household and credit card debt. And they expect us to believe this and put our hands in our pockets constantly to pay so that they can line theirs. I would actually put to everybody here today that the way people like this treat our economies and our money that we work for and give to them in trust is like going to the casino. They think the money is an easy money. We used to be a nation that built things, made things, and invented things. It's time to get back to investing in really important infrastructure like Medicare, jobs, education. The last thing we need to be doing is to keep struggling to tread water just to stay where we are when there are so many people who want to work who can't find jobs, and so many people who are working who are not taking home enough to live already. But we encourage you all to tell these stories and to let the people that you know who are struggling, that have bought into this ridiculous concept of austerity measures that we need. The money is there to create better situations for the working poor in this country. We need to invest it. We all know that in relation to our household income. We need to tell the government to stop gambling with our money.
There are lots of ways of having a fairer and more efficient system, but tearing down Medicare is not the way to do it. Make no mistake, this is a fight that we will be having well into the term of this government. The Greens will be there with you, fighting to defend Medicare, but we won't do it without the unions and without all of you standing together trying to protect one of the great institutions of this country.